According to the Eastern Cape's Department of Health, girls as young as 10 years old were among the over 500 children under the ages of 14 who gave birth in the province in the past financial year. So between 2022 and 2023, 1,841 girls aged 10 and 14 gave birth at public health facilities in the province. And this has raised alarm bells about young girls who are falling pregnant, and yet the conviction rates are not matching up, as that is statutory rape in South Africa. We speak to Nokuthula Sopiseka, Director of Re-Engineering Primary Health in the Eastern Cape Department of Health. Thank you very much, ma'am, for your time this afternoon. To your understanding, what's going on?
Good morning to Tusile and the viewers. In the Eastern Cape, we are also concerned about the rate of pregnancies in ages between 10 and 15, as well as 15 to 19. But more so of the ages between 10 and 15, because those are very young children. As you have said in your intro, that the numbers have decreased between 2020 and 2021, as well as 2021 and 2022. This is because, as the department, we have strengthened the collaboration and the intersectoral collaboration with different stakeholders. One of the issues that we have done, because as you indicate, there were very few convictions in terms of these ages as they are the statutory rape. So one of the challenges that we were having is that the parents would go and attend to these issues on their own and not forward whether the department has started the reporting, and then the parents would go and erase those cases in the police station. So what we have done as a department, we have worked with different stakeholders like Department of Social Development, Department of Education, and we have roped in the Department of the South African Police Services, because we wanted to strengthen the collaboration between the parents and the communities so that they understand what is expected of them when these cases arise in their communities. That's why we have seen a drop in terms of the number of the pregnancies or deliveries. Let's call it deliveries between ages 10 and 15.
What does a drop mean?
A drop means there is an alarm that has been raised in terms of the awareness. And a drop means that people are now starting to take ownership of those that have been convicted or that have been suspected to have raped those children as young as 10 and 15. And so the drop means that our efforts as a department are working.
Okay. Ma'am, can we take a look maybe at Christmas Day, right? So there's always excitement around Christmas Day and babies being born. So for the Eastern Cape, how many young people gave birth to babies? How many babies birthed babies?
Yes, in the Eastern Cape, we are still counting the numbers. However, we have seen plus minus 10 babies that have gave babies, as you have said it.
And so you'll appreciate, ma'am, that even though there is a drop, which is a good indicator, it is still not nearly enough, because you've got children who are being violated. And so who is impregnating these girls? How old are they? What is it that you are picking up in terms of the trend? We'll get into the parents' intervention in a few moments, but what are the circumstances around these young people getting impregnated? What happens?
In our interventions and trying to find out what is really happening, there are two major things that are happening in communities. These are the children that most of the time are the child-headed families. So there are adults that are taking advantage of these children when there are no parents around them. And also, some of the children are impregnating some of their own ages, like the 2 years above, they would pregnant those 10 and 15 years of ages. So it's the two things. It's those that are staying with without the parents, and those that are impregnated by their peers.
And so when it comes to the issue perhaps of child-headed households, how do you help, right, so that you are not dealing now with a problem of a child who has been molested, but what intervention is needed before we even get to that point, because it's almost recreating a cycle that will never end. How do you help these children, or what interventions are in place for these children who are in child-headed households?
The Department of Social Development, as I've said, is working with the communities to identify parents who can be fostering those children that are 10 to 15 years. And that one is being strengthened by the collaboration also from the other NGOs that are working with the Department of Social Development. And also what we have noted, what has been said by the children themselves in the dialogues was that some of the parents would come and pretend to be those that are helping them, and at the same time they are the ones that are violating them. Now the social development is screening those foster grandparents so that they can have people that will have the interest of the children at heart.
When it comes to the intervention of the parents, what are some of the reasons for parents going to the police station and dropping the cases?
Some of the reasons are that maybe this is a close relative. Most of the time, it would be the close relative of the family. It would be the stepfathers of the family. It would be people that are putting food on the table. So those are the reasons that sometimes they go and drop the charges. Some of them are being threatened also by the perpetrators. So, but mostly these are the children that they are raped by the families.
Are there programs that are being led by the Department of Health in the Eastern Cape where you go into schools and you speak to both boys and girls, where you then put certain protective measures, things like condoms, for instance, at schools, not to promote it, but because you spoke about peers who are engaging in sexual activity amongst each other, and then there's the issue of predators. But if these children are then doing it, is it better not then to protect them from themselves, if you will, for lack of a better expression? And so what programs is the Department of Health driving to help in the process?
I think one of the program or an intervention that we've done as a department is to have the dialogues with the parents themselves and the SGPs in those schools, because the challenge was the parents that wouldn't sign consent forms for those children to be screened properly by the Department of Health and be provided with the sexual reproductive health interventions. So we had dialogues with the parents, we had dialogues with the school management and as well as the SGPs. And after those dialogues, the schools would agree for the integrated school health service teams to go and visit those schools and provide those services. It's not happening in all the schools, I must say, however, but it's something that the department is doing. There are integrated school health service teams that go visit schools. And what we've done also as a department, we have tried to attend to these issues with the Department of Social Development as well as the Department of Education. So when the teams go to schools, they go as a team from the three departments so that all the services can be provided at the same time in the school.
Thank you very much for your time this afternoon. Nokuthula Sopiseka, Director of Re-Engineering Primary Health in the Eastern Cape Department of Health.